It's a beautiful day here at Mountain Valley Regional Rehabilitation Hospital in Prescott Valley, and I'm going to learn about trekking today. So physical therapist Jennifer Gurule has all the scoop on trekking. These are the coolest poles ever. Now, we kind of know what trekking would theoretically be, but who benefits from trekking, Jennifer?
Well, pretty much anyone who can walk and wants to get around better and explore the world around them.
Okay, and what are the benefits of it? I mean, is it good for you when you use these poles and you trek too?
Absolutely. So the nice thing about poles is you're using both sides of your body. You're not just using your legs, you get to use your arms too as you take a step. So you're working your whole body, upper and lower body.
Rather than if you were just walking without poles like this.
So it gives you a little more cardiovascular benefits. It also helps with stability, so it gives you a little more balance control for anyone who has trouble with balance.
Oh, okay, so options. What are the options for using these things? What do you use them for?
You can do basically any walking or hiking is mainly what they're used for.
Oh, okay. But different terrain and things like that too?
Absolutely. You can use rocks, you can use sidewalks, indoors, outdoors. Some people even using them in the snow, on the ice. The possibilities are endless.
I can see. Well, I've seen people out walking with these, so I know that they've become kind of popular. I think they're good for, like you say, the knees and everything.
Yeah,
Is
so
it
some
easier
of the people that really benefit from using the poles are anybody that has joint problems. Your hips, your knees are aching, maybe you have arthritis, former hip replacements. But it's also good for people who like Parkinson's, multiple sclerosis, anyone with balance issues, because you have 4 points of stability. It gives you a little more balance control than the standard cane that a lot of people use.
Right, and it looks cooler too.
It does look cooler. You gotta go with that.
I noticed that our poles are a little different. Like this has a different end of it. Tell us a little bit about the structure
There's
of these.
3 different types of tips that you find on the poles. So we have what's called a boot tip, which kind of looks like a boot.
It does,
then the standard tip, which is what most of your poles come with. And then this one you have on here is actually a bell tip. And those you can usually find online. You can purchase separately to put on your poles. And I use that a lot with the patients I work with here so that they have some balance control. It gives them a wider base so that they can have a better stability point when they're walking.
It's like not wearing stilettos all the time, wearing a wider base at the bottom. Yeah. So this is very therapeutical for them.
Absolutely.
For people, getting back on their feet, or if they have ongoing issues, or just normal people, because I think our knees and hips and stuff, they give out on us first, sadly.
They do. And it makes you use both sides of your body. So a lot of my neurological patients, they might have had a stroke, or with MS, one side of their body is more affected. So if I can give them 2 poles, it now makes them have to use their involved side more so that they can strengthen that side.
Now, do you always use 2 poles when
I generally do, because it gives you, again, more support. It also helps you stand more upright. So with a standard cane, you're kind of here. It tends to lean. Right. With the walking poles, you can stand more upright. You have nice posture. So someone who lives here can now start living here again.
If someone has a problem with one leg, the other leg can take the brunt of it. These would help out with that.
And it helps distribute that weight between those legs too.
Okay.
So now you have 3 points to unweight the leg that's bothering you or has issues.
Okay, well, and everybody's a different size. Is a one size fits all with these poles?
Well, these are actually adjustable poles. So you can see that there's 2 different spots that you can adjust on the poles to make it fit your height. There's some poles that aren't adjustable, like this one here is a solid pole.
So you have to be the right height.
I don't really recommend for these, because you have to make sure they fit you before you walk out the door with them.
Because there's a certain, you have a certain way to measure what's right for you.
So what we look at is we look at the angle of the elbow. So we want the elbow to be at about a 90-degree angle when you're holding loosely to the pole.
Oh, okay.
So we got those already sized up to fit you.
All right, we are ready. Hey, how about you show me how to go down steps?
Let's do it.
On our trekking poles. I'm loving this.
So when we're going down steps, you want to put the poles down first, and then you're going to step down. You could bring both feet down, or you can actually step down to the next one. It's up to kind of where your balance level is. Most people just do 1 step at a time, and then they're down.
Oh, all right, and that just keeps them, again, keeps their balance and
gives you something to hold on to. It's really nice if you're going down stairs or curbs where there's no rail to hold on to, and that's a lot of the community is built that way.
Let's check out the gravel. Show me what happens when you get on uneven surfaces,
Okay,
Jennifer.
so what we're going to do is you're going to do opposite arm and leg. So the pole's going to go first, and then you're going to step with your opposite leg, and then you'll reverse it to go do the other side. So we're just kind of doing back and forth.
Wait a minute, this isn't as easy as you This is like rubbing your tummy and patting your head.
It takes a little getting used to.
Right.
But the more you do it, the easier it gets. And with people that start on flat terrain, they can just start with dragging the poles behind them and just kind of get used to swinging your arms like we do when we walk. It's the same movement as when we walk, we swing our arms opposite our leg as well.
All right.
So it actually comes more naturally when you get in a good rhythm with it.
Right, because that was a little confusing. Like, I know that dogs walk that way. I mean, we with four, this is like having four limbs.
It is like having two more limbs.
Okay, so you just go opposite.
Arm and leg,
Just remember, opposite. And now what about ramps? Because a lot of people would prefer to use ramps rather than, stairs, but also if you're out hiking.
Yeah, hiking, going down hills in your neighborhood, all those things need to be, great with the poles. So what you're going to do is you're going to go put the poles slightly in front of you as you work your way down. So we're going to do opposite leg and arm still, but you're going to kick the pole out a little bit farther. And what that does is it kind of gives you a little bit of a stop as you're going down the hill.
Oh, it does, because you're not, and if you were sliding, I mean, if it's a little bit, rocks or gravel or something.
Takes pressure off your knees.
You can really
and
feel
everything.
that. Yeah, I can feel that support going in there. So, this trekking is a lot of fun.
It sure is.
I know, I can see that, as you mentioned at the first, there are a lot of people who really need to use these for stability and balance. But just regular folks who don't necessarily, it's still beneficial too.
Yeah, it's great for your health. It works your upper body, works on your posture, and gives you a little more cardiovascular workout. Yes. It's a great way to go.
And they're stylish, don't you think?
They are.
I love it. Jennifer Gurule, our physical therapist over here at Mountain Valley Regional Rehabilitation Hospital. Thanks so much for joining us and teaching us the ups and downs to trekking. This is a lot of fun. I'm going to have to get myself some poles.
You did a great job.
Maybe hot pink, I'm not sure.